How does the shadow of childhood trauma stretch into our adult relationships? It's a question that leaves us pondering, isn't it? The influence of our formative years on our adult lives is profound, and when those early years are marred by trauma, the impact can be far-reaching and complex. Childhood trauma takes many forms. It might be physical or emotional abuse, neglect, or the sudden loss of a loved one. It might be exposure to violence, substance abuse, or a myriad of other distressing experiences. These events leave indelible imprints, shaping the way we perceive the world and ourselves within it. When we speak of trauma, we're talking about more than just the events themselves. We're talking about the response to those events, the deep emotional and psychological distress that can linger long after the traumatic event has passed. This distress can alter our emotional landscape, our self-concept, and our capacity to form and maintain relationships. The way childhood trauma affects individuals can vary greatly. Some may find it difficult to trust others, resulting in an avoidance of close relationships. Others may become overly dependent, seeking constant reassurance and struggling with fears of abandonment. Some may struggle with self-esteem, feeling unworthy of love or care. Others may repeat patterns of abuse or neglect, unconsciously mirroring the behaviors they were subjected to. In the context of relationships, these effects can manifest as difficulties in forming secure attachments, struggles with intimacy, or patterns of conflict and instability. They can lead to a cycle of unhealthy relationships where trauma bonds, connections formed in the context of shared pain and struggle, replace healthy, respectful bonds. Now, it is essential to note that trauma is not a life sentence. With recognition, understanding, and appropriate support, individuals can heal from their traumas and break these cycles. They can learn to form healthier relationships, rooted in respect and mutual care. So, childhood trauma can significantly shape our adult relationships, but how exactly does this happen? Let's delve deeper into the science behind trauma, the patterns it can create in our relationships, and most importantly, the journey towards healing and growth. Trauma, experts say, has a profound impact on the brain, especially a developing one. Indeed, the science of trauma is both fascinating and alarming. Neuroscientists and psychologists have been studying this subject extensively, and their findings are quite revealing. Let's delve into the human brain for a moment. Here, the amygdala, often referred to as the brain's alarm system, is responsible for our emotional responses, including fear and anxiety. When a traumatic event is experienced, the amygdala springs into action, triggering a stress response that prepares us to either fight, flee, or freeze. But trauma doesn't just cause a momentary reaction, it can also change the brain's structure and function. In fact, research shows that repeated trauma can cause the amygdala to become hyper-responsive, making it more likely to trigger a stress response, even to non-threatening situations. This is where it gets increasingly complex. Trauma can also affect the hippocampus, the part of the brain that helps us process memories. When trauma occurs, the hippocampus can shrink, making it harder to form and retrieve accurate memories. This can lead to a person reliving the traumatic event again and again, as if it's happening in the present. Now let's discuss the prefrontal cortex, the part of the brain responsible for executive functions like decision-making, impulse control, and emotion regulation. Trauma can disrupt its functioning, leading to difficulties in managing emotions and making sound decisions. So, what does all this mean for relationships? Well, the effects of trauma can lead to a host of relationship challenges. Difficulty in regulating emotions can lead to volatile relationships. A hyper-responsive amygdala can cause a person to perceive danger where there is none, leading to trust issues. And problems with memory processing can make it hard for a person to move past painful experiences. This neurological impact of trauma can lead to certain patterns in relationships, but what are these patterns? To understand this, we'll need to explore the various ways that trauma manifests itself in our relationships. Stay tuned for that in our next segment. Living through trauma can create certain patterns in relationships, often known as trauma bonding. This might sound like a cryptic term, but it's an essential concept to understand when exploring the impact of past trauma on our present relationships. Trauma bonding is a phenomenon where the victim of trauma forms an emotional attachment to their abuser. It's a survival strategy that arises from the volatile cycle of abuse, where periods of mistreatment are interspersed with moments of affection or kindness. This dynamic can cause the victim to develop a misplaced sense of loyalty, attachment, or even love towards their abuser. How does this play out in relationships? While those who've experienced trauma in their past may find themselves drawn into relationships that echo the dynamics of their traumatic experiences. They may find themselves repeatedly involved with partners who are emotionally unavailable, abusive, or manipulative. In these relationships, the pattern of trauma bonding can repeat, causing further emotional harm. Renowned psychotherapist Dr. Judith Herman explains that trauma bonding can create a powerful emotional attachment that is resistant to change. The victim may deny the reality of their situation or even defend their abuser, making it challenging to break free from these harmful dynamics. But it's not just the person who experienced trauma who is affected. Their partners too can find themselves drawn into the cycle of trauma bonding. They may feel helpless, frustrated, or confused by their loved one's behavior and struggle to understand why they stay in harmful situations. These patterns can be incredibly complex and deeply ingrained, making them difficult to recognize and even harder to break. They can create a cycle of hurt and confusion that can last for years, even decades. But here's the good news. Understanding these patterns is an essential part of the journey toward healing. Knowledge is power, and recognizing trauma bonding for what it is can be the first step toward breaking free from its grip. These patterns may seem daunting, but understanding them is the first step toward healing. Remember, it is possible to break free from the cycle of trauma and build healthier, happier relationships, and that journey begins with understanding. Healing from trauma is a journey, and it's one that often involves rebuilding our understanding of what a healthy relationship looks like. Healing from trauma is not a straight path, but a winding road filled with peaks, valleys, and detours. It's a process, an ongoing journey that requires patience, self-compassion, and resilience. Often it involves redefining our perceptions and beliefs about relationships, reshaping them from the contours of our past experiences. Expert advice and research findings underscore the importance of therapy in this healing process. Therapy provides a safe, structured environment to explore past traumas, understand their impact, and develop effective coping strategies. It's like a lighthouse in the storm, guiding us towards healthier shores. A therapist can help us see patterns that may not be apparent to us, patterns that are the ghosts of past traumas. They can help us understand the why behind our actions and reactions, and most importantly, they can equip us with tools to break the cycle. But therapy is just one piece of the puzzle. Self-care is another essential component of this journey. It's not just about bubble baths and spa days. It's about setting boundaries, listening to our bodies, nourishing ourselves physically, emotionally, and mentally. It's about understanding that it's okay to put our needs first, to say no, to step back when things become overwhelming. Support from loved ones is also crucial. Having a support system that understands, respects, and supports our journey can make all the difference. They can provide comfort in moments of distress, encouragement in times of doubt, and companionship in periods of loneliness. Healing is a process of transformation, of shedding old, harmful patterns and embracing healthier ones. It's about learning to trust again, to connect, to love and be loved. It's about understanding that our past does not define us, that we are more than our traumas. It's about recognizing that respect is key, that a healthy relationship is one where both parties feel seen, heard, and valued. It's about knowing that it's okay to ask for what we need, to express our feelings, to assert our boundaries. Healing is possible, and a crucial part of it is understanding what a healthy relationship looks like. But how can one build a healthy relationship after experiencing childhood trauma? It may seem like a daunting task, but it's entirely possible with the right approach, patience, and understanding. The first step is understanding that healing from trauma is a journey, not a destination. It's not about erasing the past, but rather acknowledging it and learning how to move forward. And this journey can be made easier with the help of a trained professional, such as a therapist or counselor. They can provide you with tools and strategies to manage the impact of trauma and navigate through the complexities of relationships. Now let's talk about respect. Respect is a cornerstone of any healthy relationship. It's about recognizing the other person's feelings, needs, and boundaries, and treating them with kindness and consideration. It's about creating a safe space where both you and your partner can express yourselves freely without fear of judgment or criticism. Communication is another key factor. Open, honest, and clear communication fosters understanding and trust. It's important to be able to express your thoughts, feelings, and concerns, and equally important to listen and understand your partner's perspective. Remember, it's not about winning an argument, but about finding a solution that works for both of you. And finally, understanding. Understanding that your partner may not fully comprehend the depth of your experience with trauma. It's essential to be patient and explain how your past affects your present and how it might influence your reactions and behaviors. This understanding can foster empathy and deepen the bond between you. Research and expert advice have continually emphasized these points. Building a healthy relationship after experiencing trauma is not a straight path. It's a journey filled with ups and downs, twists and turns. But with the right approach, respect, open communication and understanding, it's a journey that can lead to a fulfilling and loving relationship. With understanding, healing, and effort, it's possible to build healthy relationships even after experiencing childhood trauma.